Well, here we are, Renee, another podcast. And boy, it looks like there's a few more people on the screen than normally during a podcast. You want to tell me what is going on?
Well, you're probably going to have to be the one telling me what's going on. I'm the new person to this party, but we're going to have a conversation today with our folks and our friends in Nebraska about mental health and what they're working on in their state. And oftentimes we learn a whole lot about our own state in these conversations. So I'm pretty excited. But before we kick that off, Jason, what is going on the farm right now?
Well, this is why I'm so at home in Nebraska, because it's just like being here in Iowa, right? All we do is think about corn and planting and hauling corn to the elevator. And Renee, I've been complaining, but I'm still emptying that gigantic grain bin I built last year and hauling stuff to the elevator at the same time we're trying to plant. And it's just I'm getting exhausted because I'm thinking already it's only a few months away and we're filling that sucker up a couple of times this year because we're
Mhm.
planting more corn this year. So how's that for a rant? We have too much corn. It's horrible. Our yields are off the charts and it's not raining enough and there's not enough sunlight.
Well, what would it be if we didn't have a farmer complaint to start us off? I mean, what would this even be? So, Jason,
Absolutely.
why don't you talk to us about our guests? We have a guest from Nebraska Cures and from NAMI, Nebraska. Very excited to have everybody. So, Jason, talk to us. Tell us who we got today.
Yeah, I'm really excited about this episode, Renee. We've got with us James Bowers and Amanda McGill Johnson, both folks that we met when we were doing work in Nebraska, when Brent and I were out there for 6 months working on a study around behavioral health and kind of some of the movement they want to do. And during that time, we reached out. We always reach out to local coalitions and collaborations going on. And I came across James, who's in charge of NAMI Nebraska, and he introduced me to Amanda, who is doing some work and in charge at Nebraska Cures. And so I'm going to turn it over to them to tell us kind of how their collaboration came to be, because I think it's really excited as we think about how mental health is starting to get a foothold of how we can better advocate in the state next door. Amanda, why don't you kick it off?
Hmm.
Yeah, I'd be happy to. So I'm Amanda McGill Johnson, Executive Director of Nebraska Cures. And we're an organization that has historically promoted, supported, and advocated for medical research in the state of Nebraska. We've been around for 24 years. And coming out of the pandemic, our organization decided to expand our scope of work a bit into some different areas related to public health where we saw there was a high need. And so when we expanded outside of just supporting medical research, we looked at maternal child health, climate's impact on health, and then mental health. So we started to get into that space. And frankly, medical research covers all of those,
Oh,
including research into mental health, which is something I can talk about a little more. But we were asked to join James in trying to organize the nonprofit community around mental health and addiction advocacy, which has really taken off. And we're doing a big study. And I'll let James introduce himself first, though, before we start talking about that.
thank you, Amanda. James?
Yeah, so I am the executive director of NAMI Nebraska, and NAMI stands for the National Alliance on Mental Illness, and so we are the Nebraska chapter. NAMI is the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans and their families affected by mental illness. In Nebraska, we provide education, advocacy, and support for those impacted by mental illness through our support groups, our education courses, so that way folks who are newly diagnosed or folks that are supporting a loved one with mental illness can learn the tools, learn about mental illness, and learn how to take care of themselves and other people. And also, we are working to provide advocacy. And so we offer programs to be able to help folks with lived experience tell their stories to lawmakers and policymakers to help make a better mental health system. And so it's been an honor to be able to work with Amanda and Nebraska Cures. And we came together probably about a year and a half ago at this point to lead the coalition that Amanda was talking about of nonprofits, which has led us to where we're at today.
Yeah, that's awesome. Renee and we've talked about NAMI a lot on our podcast. We've both been very connected and supportive of our local NAMI here in Iowa, and we always guide people to their state NAMI organizations everywhere that we go because it's just a gold standard of resources for families of folks who live with mental illness, and what a great support structure it provides. So let's tell us about this collaboration. you guys are doing, because I think that's part of what's most exciting. We were able to come out at one of the initial convenings you had where you really kicked off some of the research that you've started doing, and that's underway now. So Amanda, do you kind of want to give us kind of a thumbnail sketch of what's been happening in Nebraska and how you've really mobilized not just individuals, but nonprofits and others all across the state to really get engaged about the impact of mental health, and what it's doing to your communities?
Absolutely. And in many ways, I feel like we're still in our infancy. So many folks probably haven't heard about this movement yet. But when James and I were first recruited to work within the nonprofit space, we found ourselves really just watching what state senators introduced. I myself am a former state senator here in Nebraska. We were just watching what other folks introduced and kept the coalition sort of updated on what was happening. And so last summer, we were tasked with how do we be more proactive in bringing ideas to lawmakers? Because you can see the broad interest in a very nonpartisan or bipartisan way in mental health. And so, as we started to try to identify what those things could be, we realized, man, we really need a better sense of where exactly we are at in Nebraska in terms of a continuum of care and, being rural and urban. How do we identify where the resources need to go? All of the things, right? And so we wonderfully found someone willing to sponsor a comprehensive mental health study, which is underway right now. But then we said, okay, let's launch this with a big convening that we held last October. And that's, Jason, when you came out and spoke to the group about really trying to get them to think outside of the box, right? Like not just within our current system, but let's think bigger. Let's think about those big problems. And we had people outside of the nonprofit community there, like schools, for instance, were well represented. But we still probably didn't have the whole spectrum. There weren't enough from the justice system and other folks who really touch mental behavioral health. But moving forward, and with our study right now, we're really being mindful of including all those voices. So then as we move forward with ideas, we can have everybody at the table. And we've been really excited about the engagement that we've had so far. I don't know, James, what have I missed? Or do you want to talk about steps after the study or one of those?
No, I think you did an excellent job summing everything up. I think the one thing that was really great about the convening and the fact that this will be an ongoing gathering of folks is it really does blend everyone together, from providers to leadership at organizations and people with lived experience. And being able to come together and hash things out, I think really helps everyone at all levels feel really empowered and feel like that they have a say in the next steps that happen to making a better mental health system.
Absolutely. Renee, did you want to ask a question? Because I'll just keep going if you don't jump in. And I know you don't have a problem jumping in, but
Well, I do have a question for Amanda. How many groups are participating with you in your collaboration? I know there's you and James. Are you the only two, or do you
Yeah.
have other associations and groups that are working alongside you?
For sure. It's about a dozen
Okay.
organizations. Some of them are like major nonprofit funders, the
Oh, great.
Schumann Foundation, Logier Foundation, White's Foundation, like a bunch of the big foundations, Omaha Community Foundation.
That's fantastic.
And then other coalitions like NABHO, former Senator Annette Dubas over there, and the Coalition of Providers. And we welcome more to the table to get the word out. Like we activate. When I said we were organizing the nonprofit community a little bit, is there are existing nonprofit advocacy calls during our legislative session that started a couple of years ago.
Mhm.
And so any nonprofit that's a member of any of the lead groups of that, like our nonprofit association in the Midlands, can participate and get updates on bills that are relevant to nonprofits in general during legislative session, just to increase involvement from the nonprofit community. But as James said, like getting the lived experience in there, just the other pieces of the pipeline, frontline workers versus leadership in organizations, is just really critical in making sure we're approaching all aspects and
Mhm.
incorporating all of those voices. I include medical researchers in there because
Mm.
I think they're often left out. And frankly, I feel very strongly that we need to invest more into medical research, research into the brain, if we're ultimately going to solve some of these problems in a core way.
Yeah, that's a really neat organization because those people aren't always at the table together. So it's a nice combination. So thank you for that. So Jason, I know you had some data you wanted to talk about related to some of this, what some of the work is that all of you all did in Nebraska. You want to share about that some?
Yeah, I mean, I didn't go back and read my entire report, which I probably should have before this. But I think Amanda hit on a couple of points, right? A lot of the work that we did in Nebraska was really heavy on the judicial system and the court systems of how many people get caught up with charges and put in jail instead of getting the treatment that they need, and just how that pipeline doesn't get people through a continuum of care that makes sense, that gets people to the right level of care at the right time. And so we see higher than average suicide rates. Over 20% of Nebraskans are unable to get the help that they need when they're out there getting it. Some stuff shows us higher. And you have a high rate of incarcerations, a much higher rate of incarcerations. And sometimes we've been doing this when we go to other states, Renee. We've been looking at how many times higher is the state we're in's incarceration rate than, around the world, like comparing it to the UK or Europe. And generally, anywhere in America is 4 to 5 times higher because we just don't have a good system of supporting people and getting the right people in jail at the right time and being able to treat people who have untreated and diagnosed mental illness. And so, part of what we did in the work and the research we did there is very complementary to the work that Amanda, and James, and then their teams are doing to really look at that continuum of care moving forward. If you recall, I created the Nebraska Continuum of Care on the back of a napkin when Brett and I were there. But I still show that slide, Renee, when we go to other states. I know you made me
I
take it out
removed
of the
that slide.
Montana. You took it out of
Yes.
the Montana slide deck.
Every
Next
deck I
week.
can. That's right.
Next week we'll be in Montana. I think it's a great
No, it's not.
visual, but we
It's
just
not.
agree to disagree, Renee. But the point being is it should be known to everyone, and I think that that's really the takeaway here. And when we talk, oftentimes others say, how do we get together? How do we create a movement? I really like Amanda's approach, right? It's finding funders and then linking them with organizations and bringing people together. So oftentimes we go to states and it's so fragmented that those groups don't know how to come together. And so I really see this as a model of, Amanda, what you and James have done, because so oftentimes it's so hard to get together and then also have the funding to back it, to actually then be able to distill what the needs are so that then you have an actionable plan to move forward with, right? Change takes time, but you need a solid foundational plan for the next 3 to 5 years to start to see some of those policies move their way through the legislature. And so it gives me energy. It gets me excited when you talk about what you've done. You talk about being in infancy, but what you've done is really, really, this is the hard part of the work. Now you're going to have a plan, you're going to have focus and goals, and you've got all these people onboarded, and you're just going to keep bringing more people on board. So tell us about what the next steps are, because I'm just excited to hear about it.
Well, and we looked over the fact that we had you back even in January to talk
Right,
directly to state senators,
right.
about what you were seeing in other states. Again, just trying to get them to start thinking. Not that we had like specific examples of what we should do. We did have some policy briefs that came out of that first convening where the people in that room came to consensus on a few items to prioritize. But this study will really crystallize, those top half a dozen things, build up recommendations, a continuum of care to try to pursue that we can move with going forward. And I know James and I met just a week or two ago to talk about what is next. We're going to do another convening in October to really release these results. And then we're envisioning work groups in the different areas that are highlighted coming out of this. And what I hope to build, I think what we both, I think, hope to build is that unsiloing that's happened, because
Yeah.
you did have the providers doing a great job on rates in Nebraska. You have child psychologists working on a piece of the pipeline. You have probation, or you have some people who are county attorneys or defenders, working in certain things. How do we build up support across that spectrum? Something for people to plug into and see recommendations that will very likely hit on different parts of that continuum of need, from the kids with higher anxiety than we have been seeing historically to the ones who were in those higher levels of care, the adults in higher levels of care. So having that one place to get engaged and look at all of those and advocate across the spectrum to them.
Which I do want to just point out how amazing it was that Amanda, when we were back there for the legislative meeting, when we talked to folks, they're like, how hard is it to get the ear of legislators? Well, we had almost a third of your legislators in the room to learn
People
about what they
care.
could do. People care, right? This was
Yeah.
not an issue that mattered what party you were with. It didn't matter any of that. We had a broad spectrum of folks who came to the room, and we had an hour and a half meeting. It was really quite amazing. There's not many states I could go into and get a third of the legislature in the same room, right, during
Yeah.
session, and have a conversation of what we're going to do. And so I just think that really speaks to the work that you all are doing, because there's so many folks out there like, how do we engage? How can we do this? We get asked that question a lot. And I think, your model and roadmap is really an amazing way to go. James, where do you see NAMI going as it fits into this project? And how can you leverage NAMI to be supportive of everything that's happening?
Yeah, before I answer that, I want to throw one other comment out there.
Yeah.
I think one of the great things about, being able to get people together and whatnot, and the success that we have, I think really shows that Amanda already had strong relationships built with funders and with community members and with a lot of the existing state legislators, right? So people already viewed her as an expert and someone that's credible, as opposed to someone that may not be as well known stepping onto the scene, would not be able to draw the same kind of reaction from funders, the community, and legislators, right? So I think that really speaks to a lot to, Amanda's position in the community and the fact that people really trust her, you know what I mean, to take that time out. So, I want to acknowledge that. So, shout out to Amanda for
That's
that.
very kind. I'll pay you later.
And I think when other states, and the reason also why I bring that up is because I think when you talk about other states kind of trying to replicate that model, I do think it's important to kind of find those key leaders that have that experience, that already have that buy-in and already have those relationships built, right? It's not Amanda coming in and trying to establish those relationships now. Those have already been longstanding, and her former work as a legislator, I think, has really been one of the things that has boosted the progress and success of this coalition and convening and whatnot. So in terms of, kind of like NAMI's role and NAMI's position moving forward, I think that's another reason why Amanda and I work really well together, right? My background is I'm a clinical social worker, and if I'm able to bring in the lived experience portion along with it, right? I think that really adds a lot of weight to the results that are coming out. So NAMI Nebraska, we have affiliates all across the state. And so if folks are interested in getting more involved, especially in greater Nebraska, please reach out. Good email address that will hopefully be long-standing even way after I'm gone is info@naminebraska.org. And if folks are interested in starting an affiliate in their local community to really bring the advocacy and the voices in their community to the state level, or even interested in offering programs like our support groups or our education programs in their community, we will pay for the training, we will get folks hooked up, and we'll help provide the tools in order to do that. And so we're really tapping into our existing network of folks with lived experience to be able to help get folks to these convenings and to help fill out the survey to really gather up those voices. The other thing that NAMI Nebraska does is we offer a program called NAMI Smarts, and it's a 16-hour training to go over some of the basics of policymaking, some of the basics of mental health legislation, and really how to craft that story in a way that's authentic and true and powerful. And so if we're able to kind of bring that people power portion to this coalition, I think that is what's going to kind of ground everything and make everything more realistic and bring it back down to how do we create a system that serves people and helps families and individuals get access to care and to have better outcomes.
Absolutely. That sounds great. Renee, do you have another question?
Well, I was just thinking about that component that James was talking about with the coalition for people with lived experience. That's the piece that's often missing in coalitions, to be fair. And lots of smart people sit in a room and talk about what should happen, but they miss how it actually gets applied on the ground, right? And so if you sit too high and just sit around thinking systems, the reality is you have a very rural state, and it really matters if they have access in the rural communities, right? And so so I think on this whole thing, James has one of the most important pieces, because it is that person lived experience that's it's make or break the system. We can talk all day about what a system looks like, but if it doesn't actually work, and then we always talk about too on our podcast a lot, but how states have those stars on a map that it'll say that your program is in whatever counties, but it exists for one person every blue moon on Thursday.
Yeah.
And that put a star that says, oh, we have that. But that's not true access. So when you guys are doing like this work, I mean, that's the most important part. So I'm really excited to hear that NAMI's at the table because you guys have so much you can bring to this conversation. Because again, what difference does it make if the system doesn't actually access people? And so that's really cool. And on the other side for Amanda, the part about all the funders, and that's another piece that's often missing, is just that funding component of the private sector of who could get involved. And lots of times the system just looks at the state and says the state should pay us more money, when in reality it's going to take a lot of different types of money to get where you're going. So this is a really cool conversation, and it makes a lot of sense as to what you guys are doing. So thank you for your hard work. It sounds like you have some really big opportunities to make some headway in the state, which is really cool.
And there's some good momentum that is already growing, since this is an issue people care so much about. Like,
That's right.
there's a conference in a few weeks among schools, and
Yeah.
how do we do mental health better? It's out in Kearney, Nebraska. And school districts have local control, and we have something called educational service units that do a lot of the mental health stuff in rural areas. And some maybe have more advanced systems that they've put in place. And so how do they all learn from each other and develop that piece, so then we can plug into that and help inform it, help bring our advocacy experience. Like, James is on the Lincoln City Council. He's been a great advocate in public policy too in the past and brings legitimacy to this. How do we help inform them in their efforts, because they might not know what advocacy looks like, or what they maybe should or should not bring to state legislators? What is more of a local control issue or a federal issue, or helping them differentiate those things.
Right. And for Iowa, we really made progress in behavioral health when the business community was at the table, when the businesses started understanding how much money they were losing with time not spent at work, or just with all the different medical bills and issues and, family leave and all the things that happened around behavioral health. When the business community said, hey, we care about this and need to be a part of it, it really started to make change. So that's really exciting that those pieces are part of what you have, because that's the real deal, right? That's where the rubber meets the road. If businesses don't have employees because nobody's well enough to work, we then have issues. And then when you don't have business, you don't have jobs, you don't have jobs, you don't have economy, you don't have economy, you don't have housing. I mean, it just rolls. And so everybody at the table is a big deal. So I remember when Brent and Jason got back, how excited they were for all the people that were in the room, because that's such a big deal. That, don't take that for granted. That does not happen often. And so that's a really cool thing that you guys have. So it'll be really exciting. So what's next? You said you have a training coming up for schools. You've got something in October. When are people, if they're tracking along with you, when are they going to know more about what you're doing next?
Yeah, I just want to jump in and add one thing into there, just make sure that I don't leave that out, talking about the investment and everything. I also, want to thank the funders who are investing in making sure that people's lived experience get there, right? Providers and
Yes,
leadership,
that's awesome.
this is typically part of their jobs, to be able to go to this, and they get leave from their work and they're salaried, right? People with lived experience or family members often are taking times out of their job, right? Or, they're not usually getting paid, and they have to go and share some really personal things about a topic that's really stigmatized. And so I'm really thankful for the funders in Nebraska that have been able to provide a stipend to be able to allow people to take off from their jobs, be able to pay for the travel, to be able to get their voice heard, because like you mentioned, that is often the point that is missing. And so again, when we're talking about replicating this in other states and whatnot, one, I want to express gratitude for the funders in Nebraska, like Sherwood, Whites, and Lozier, that have allowed that to happen. But also in other states, if states want to be able to do this, it's important to have those funders be able to invest in that lived experience. So thank you to the funders in Nebraska, and also as a point of recommendation for other states.
It is only through having them that you hear things like, I was at a different summit a few weeks ago where we have a Nebraska family helpline that we set up when I was a legislator that gets used and is great, but not enough people know about it, or I would argue, or think it's accessible, or think CPS is, child services is going to be called on them. And so through those lived voices, hearing their concerns that you can change how you market things, or, how accessible something is. So it is just, even at that basic level, is just so important. In terms of next steps, we'll have our formal convening October 1st, and then we envision putting together work groups. We don't know what the recommendations are yet in this
Right.
report, because the consultants are still putting that together. But we envision building work groups around those. We have engagement from lawmakers, from some county commissioners, some of the right people that, if we are looking to expand problem solving courts, I feel like we have the right people engaged in that, and to what I said before, schools and all that. So building out those work groups so that hopefully, I don't know if we'll have the big proposals for 2026 in the legislature. That might be a little ambitious, but to be really working on them, low hanging fruit, if you will, like
Right.
any accessible things before, going into the following legislative session.
That's awesome. That's really cool. And it takes a long time to get that legislative stuff ready. And we talked about this on a different podcast, but you guys have a different challenge with term limits. And people can say whatever they want to say, but that's a challenge for you guys because you got to get so many new people in. And as soon as they understand or get educated, they're back out again. And so that's hard. And so for you guys to educate people quickly and effectively, that's why what James is working on with the SMART program of helping people tell their stories in a concise way that makes sense is so important, because you've got to do it so many times in your state because it's always new people. So you just have a uphill battle with some of those things that maybe some other states have a little bit of a different issue.
Yeah, like in Nebraska, since we only have one house, our friends
That's
and I
right.
listening may not know that we only have one house. So when your 8 years is done, you're not jumping over and serving in a
That's
different
right.
house. Or we have some people take time off and go back. We have two
Oh,
people there right now who either
okay.
lost re-election and came back, or someone I served with who came back. So you see that a little bit, but then sometimes they struggle with how different people.
Right.
They're not serving with the same people, so it's a totally different landscape as well. And so it does mean having to be very forward and educate in a very basic level. Like when Jason came into Nebraska, I'm like, you have to talk like these people don't know much about mental health, other than that they're
Right.
seeing it in their community, right?
Right.
But they don't know Medicaid or how that's set up or how
Right.
the money flows. Like they don't know that stuff. And so we need to make sure we're communicating and educating them behind the scenes on those things to bring them up to speed.
Yep. As a legislator, one of the things I always remind legislators is the convening component. That is a basic thing that because they have a title and they have the job they have, if they say, we're going to get together about this, people will show up. And so oftentimes that seems so simple, so basic, but that's so important. And so then you could bring in folks like James and folks like you that know what you're talking about. They could lead, you guys could lead the meeting, but the senators could be like, hey, I want to get my hospitals together and pull them together and then bring you into those conversations. So sometimes we have to teach that basic, hey, just call a meeting and then people will come and help. And so, it is different. You can't educate the same level for everybody. So you've got to be able to explain it. But I've learned myself that if I don't know it well enough to explain it that simply, then I don't know what I'm talking about. So it just helps me learn my story even better to tell it more simply.
And don't be afraid to tell your legislators to convene people. Renee told a legislator to convene people, and I have to go to the Capitol tomorrow to meet with him because we're going to get together 6 hospital CEOs because Renee voluntold me that that's what we're going to go do. Right. And we have a legislator who's like, I forgot. They've all been coming to me separately. Why don't we get them in a room together? And Jason, you're going to lead a discussion with us. And I'm like, that'd be great. Because that's how we solve problems. Right. And I think that's the takeaway today is don't forget the power of convening. Right.
Yeah.
We can convene at so many different levels. Go ahead, Amanda.
And I think we have some great senators who are really interested in that, interested in this topic, but we've had a couple of difficult years in our legislature, but I think there are folks right now who really want to solve problems or convene and work through things. And so several of them, like our chair of the Judiciary Committee, participated in our survey. Like it's a great way, or our stakeholder interviews, to get their engagement early on, see their investment, and then ask them to do those things, that you're talking about, help us convene and really make progress and work through. The devil's always in the details, right? And so having them at the table is really foundational. Like you need to have it there if you want to make that more significant change.
Absolutely. In our show notes today, we will have links and emails for both Amanda and James. We'll have NAMI Nebraska. We'll have Nebraska Cures will have all the information available to you. So don't be afraid to check those show notes, and we'll have information loaded in there for you.
Yeah, I'm really excited for people that want to know more about bringing maybe funders to the table, businesses to the table. We've highlighted other areas in our state that are doing a good job of that, and then since then we've made additional connections with other parts of the state that are like, oh, we want to do what that part is doing. So don't be surprised if people reach out. They may want to know what you two are doing, and we try to make those networks and connections because all of us, things may not work the same everywhere, but the general principles apply. And so people will always want to reach out for those success stories. So thank you guys for being those and being heroes in Nebraska. That's a pretty cool deal. And so it's nice to meet you all. And thanks for the hard work you do because this really matters. And behavioral health care is healthcare, and it's not partisan. And we will fight that to the day we die because it is everybody's issue. It's everybody's business. And so thank you for what you do. But before we go today, we want to talk about the recovering politician self-care policy of the week. Like Amanda, I'm a recovering politician. I don't do that anymore, and I try to stay the heck out of it. And part of my plan for self-care this week is I work from home. I had a business coach tell me I was way too available in the office. So all the drama in the office came to my office. And that was exhausting. And she's like, if you worked from home, you could actually think and you could get some stuff done that you have to do. And I was like, what a deal. And it works. So for those of you that have to be in the office all the time, maybe you want to be at home. And for those of you that are home all the time, maybe you need to get out of your house. And so change of scenery does wonders. So I just want to remind people that you have the opportunity to move and do your job. Before we go, James, do you have anything, final statement you want to say about anything that you want to promote or things you want people to know before we kick this off today? Is there anything you'd like to wrap up?
As we grow this statewide network of local affiliates and people with lived experience, if you live in an area where there is not a NAMI affiliate, or you want to see some of our programs there, like our 8-week program for peer-to-peer or for family-to-family, please don't hesitate to reach out. We will provide the tools, we will pay for the training, and we will support you every step of the way to build a chapter in your local community. Just reach out to info@naminebraska.org, and we will have our walk coming up on May 17th at the University of Nebraska, Omaha. And if you want to get together at a community event and have a great time, come on out. May 17th at the University of Nebraska, Omaha, 67th and Dodge. We'd love to have you there for our NAMI walk.
I've done a few NAMI walks. Those are fun. Everybody should get out and do that. Amanda, anything you'd like to close up with before we go?
Yeah, just if you'd like more information, visit our website. That'll be in the show notes, nebraskacures.com. You can also sign up to be a science advocate. And you can even, if you're really only interested in the mental health piece, you can just click that as the topic you're most interested in. And that will get you on our email list for updates. And I do make occasional news posts too about what we're working on and how to be involved in it.
Awesome. And now, Jason, anything you need to say before we go?
Well, I was just going to say that just as a reminder to our guests who are watching us on YouTube, if you can see, guests get this sticker that says, I stepped in it. And so it's kind of, for more people to think about coming on the show and talking and being brave like Amanda and James and sharing what's going on in your local community. That's the only way you can get an I stepped in it sticker. It's exclusive to those who come on the show and do an episode with us. But what can other people get, Renee?
Well, if they follow us on LinkedIn or Facebook or YouTube or want to give us a review and tell us what we've done and if you've enjoyed it, you also get a prize. Jason has those for you as well. So thanks everybody for stopping in today. We talked a lot about Nebraska, awesome things going over there with convening and bringing people to the table who all care about behavioral health. And just like Jason and I, so it's really nice to meet them. If you want to know any more information, tons of information in the show notes, please reach out because they're doing great work and they would love to help you. Have a great day, everybody.